This is Corey Bishop. This is the assessment first video for Liberty University for Nursing 210. We'll be doing an assessment of the skin, head, neck, face. Your name?
Carol.
Alright, Carol, I'll be doing your assessment today. We're going to start with the upper extremities. Just want to make sure I understand this. The skin is warm and dry to the touch. The skin is a tan complexion with no evidence of tan lines. It is smooth to the touch with even hair distribution. Skin turgor is good, which evidence of good hydration. There's several macules or primary lesions in the form of macules dispersed across the distal portion of the anterior right upper extremity. Lower extremities, you just let your legs relax here. Again, is a tan complexion, no evidence of tan lines. The skin is smooth to the touch, texture-wise. Hair has been shaved, but you can feel even hair distribution. Skin turgor is again good, which is evidence of good hydration. Warm and dry to the touch. Palpating for edema. There's no edema palpable. And we'll be looking for varicosities in the legs. And there are several primary lesion forms of macules on the medial and lateral aspect of the knee on the left lower extremity and the medial portion of the right lower extremity on the knee. Alright, we'll take a look at your nails with the lower extremities. The brisket cap refill. The nails are polished and painted, and they are smooth with no ridging. See your hands. Upper extremities. Cap refill is good. Again, the nails are smooth. Color is pink. Cuticles are pushed back. There's no hangnails evidence. They're well manicured. There's no ridging. The nails adhere well to the nail bed. And then, if you will, take your fingers and just do like this. Little fingers. Little finger. And then your thumbs. So we're looking, there's a 160-degree angle to the nails. There's no evidence of clubbing. We'll go ahead and move back to the head. The head is neutral inline position. Is normal cephalic. We'll palpate the scalp. The scalp is freely movable. There's no signs of crepitus. Scalp appears moist. There's no signs of dandruff. Do you dye your hair?
Yes.
You can tell that the hair has been dyed. There's dark brunette at the base, at the roots. Texture of the hair is slightly coarse. And no split ends are evident. Alright. Close your eyes. Palpating paranasal sinuses. Alright. Now I want you to do a couple things. If you'll smile and frown. Alright. Puff up your cheeks. Purse out your lips. Close your eyes. Open your eyes. Try to close your eyes. Alright. Tongue in your cheek. Alright. And now if you will open your mouth, close your mouth, clench your jaws, move your jaws side to side. Alright. And grit your teeth. So we're assessing cranial nerves 5 and 7. Alright. Next thing we want to do is Before we start, I'm going to scan the room real quick. This is our cameraman. Okay. Thank you, Mr. Cameraman. Alright, we'll go ahead and continue our assessment with the eyes. Before we would bring the patient in to be assessed, we will go into a Snellen and Rosenbaum's test. Snelling, you'll be looking at distance vision, and Rosenbaum will be looking at close-up vision. We'll do this from 14 inches away. If the patient wore corrective lenses, then we would do so uncorrected, and then again we would do it with corrected lenses. Alright, the next thing we're going to do is we're going to assess cranial nerve number 2. If you will, cover up your right eye. This is the bunny. want you to tell me when you see the bunny.
Sit. 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 Sit.
Alright, 17.
Sit. 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 Sit.
Alright, cover up your other eye. 17.
Sit. 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 Sit.
Okay. Next, we're going to assess cranial nerves 3, 4, and 6. And have you look at the pen. Follow the pen with your eyes only. Okay. So we're assessing the 6 cardinal fields of vision. Next thing I'm going to do, I'm going to have you look at the wall behind me. I'm going to tell you focus on the pen. Focus now. Follow the pen with your eyes. Okay. Now I'm going to have you just look straight at me. Pupils are equal around, reactive to light and accommodated bilaterally. Look straight ahead. Looking at corneal reflexes. If they were failed, then we'll do a cover-uncover test. So I'm going to have you cover up your right eye. Look only with your eyes to the wall to the left. Uncover your eye. Both eyes track appropriately. Now cover up your left eye. Look only with your eyes to the wall to the right and uncover. Both eyes track appropriately again. We've already checked the pupils. So when we look at the external features of the eye, we're looking at the eyebrows. They're similar in color to the other portions of the head, or the hair on the head. We'll be looking at their full. The distal portion, they move in upward and up and out pattern. The distal portions of the eyebrow will line up with the upper portions of the helix of the ear. Also looking at eyelashes, close your eyes. Makeup is obvious on the eyes. Eyelashes are very full. I'm going to back up. We're going to go ahead and be looking at your eye here. We're looking at the sclera, which is white. We're looking at the conjunctiva, which is pink, moist. Do some on the other side as well. Close your eyes. And palpate the lacrimal sac. And pain and pressure on doing it. Okay. Alright. Take a look at your eye here. We're looking at the lens, make sure the lens is clear. We're also looking for the red reflex. We're going to be looking at the retinacular vessels. We're looking for arteriovenous crossing patterns. We're also looking at the color and clarity of the retina. We're looking at the macula, and we're also looking at the fovea centralis. Alright, next thing we're going to do is I'm going to go ahead and take a look at your ears. Looking at the external ear, they are equal in shape and size bilaterally. They're symmetrical on the head. Starting with the left ear, we can see we have piercing times 1. There's one primary lesion forming macule on the distal portion of the ear. The helix recoils easily. The ears are clean. Fader pressure here. Okay. We'll go ahead and take a look in your ear here. We're looking at the auricle and the external meatus. We see hair and myoserine buildup present. We can visualize the tympanic membrane, which is intact. We can also see the cone of light. Alright, we're looking at the internal ear, and we can visualize the umbra, the malleus, the pars tensa, and flaccid. We're going to go ahead and move to the right ear. Again, we have piercing times 1. The helix recoils easily. We see no lesions present. The ear appears clean. We're going to look again at the external meatus and the auricle. and hair is present. Nose to room buildup is observed. The tympanic membrane is intact. Cone of light is present at 5 o'clock. We can again visualize the umbra, the malleus, the pars tensa, and flaccida. We'll go ahead and do a couple of hearing tests with you real quick. I'm going to whisper something in your ear. I want you to repeat what I say.
Disagree with Dan, South Carolina.
Alright.
Baseball, football, tennis.
Alright. Now I'm going to do a couple of hearing tests again. I'm going to be making a sound, and you tell me if you hear it left, right ear, or both.
Both.
So there's no obvious lateralization. That's the Weber's test, and we'll do the Renai test. Tell me if you hear that.
Mm-hmm.
Tell me when it stops.
Stop.
You hear it still? Tell me when it stops.
Stop.
We're looking for a 2-to-1 ratio in air conduction versus bone conduction, which is present. Here on this side.
Mhm.
Tell me when it stops.
Stop.
Hear it still? Tell me when it stops.
Stop.
Next, we'll move to the nose. The nose's midline is, it is symmetrical with the other features of the face. I'm going to be looking at external. We can see several primary lesions and forms of macula space dispersed across the bridge of the nose. I'm going to take a look in your nostrils here. In the nose, we can observe the mucus is moist and intact. Several hairs are present. There's no evidence of foreign body. Same for this side. And we can also visualize the inferior turbinates, superior turbinates are not visible. Okay. Just a little palpation here. All right. If you'll breathe in, breathe out, breathe in, breathe out. I'm going to have you close your eyes. I'm going to have you smell a couple things. We're assessing cranial nerve 1, the olfactory, and tell me what you smell. I'm going to include one side.
Sun.
Okay, very good. Keep your eyes closed. Do the same for the other side.
Alcohol.
Very good. All right. Moving on to the mouth. We're looking at the mouth. We're looking at the one thing I forgot with the eyes. We're going to be looking for lid lag, and we're going to be assessing the for that, which is not present. Going back to the mouth, looking at the lips. The lips appear moist and dark red in complexion. Are you wearing lipstick?
No.
Okay. There's no signs of chapping or cracking. If you would open your mouth for me. Looking at the buccal mucosa, which appears moist and pink in color. Stick out your tongue for me. One more time. Alright. We can see the uvula rises in this midline, which is assessment of the vagus nerve, which would also innervate swallowing. We can see the tonsil on the right is +3, the tonsil on the left is +2. Alright. Have you stick out your tongue for me again one more time. We're looking at the teeth. That's good. The teeth are clean. The gums do not appear to be bleeding. They are not receding. Alright, one more thing. I'll open your mouth, stick your tongue out. The tongue is well papillated. The hard palate is contiguous with the soft palate. We're assessing the salivary glands, which are present. Saliva is present. There's no calcifications felt. Alright. Next we'll go ahead and we'll do the ear, or the neck, excuse me. Neck is in a neutral inline position. Miss Sneeze.
No.
Okay. All right. I want to start by assessing the vertebral bodies of the cervical spine. All right. If you will, turn your head to the side, this side, up, down, all the way around. Any pain on doing that? So we have full range of motion. We're going to inspect the lymph nodes. We're feeling for pre and post auricular and occipital. We'll do submandibular. We're going to do the sublingual and the submental. Anterior cervical chain, the posterior cervical chain, deep cervical chain, and supraclavicular. And none are palpated. We're going to look at the trachea. The trachea appears midline, swallow form. Right. There's no evidence of deviation left or right, where there's also no evidence of any JVD in the neck. We're going to inspect and palpate the carotid arteries. Okay. I'm also going to be auscultating the carotid arteries using the Bell stethoscope for any bruit. No bruise are heard. We cannot visualize the thyroid on inspection. So if you will, I'm just going to have you tilt your head down and to the right a little bit. And we're going to try and palpate the thyroid. Okay. Move your head back up. And then we will go ahead and auscultate the thyroid for assessing for any bruise as well. Last thing I'm going to do is assess cranial nerve 11. I'm going to have you turn your head against my hand. Same thing this way. Push up against my hands with your shoulders. Alright. Now to conclude the assessment video. Thank you very much for your time. And again, this Cora Bishop assessment 1 of the head, neck, face, and skin. We'll scan the room one more time. Mr. Cameraman.